Lucky Land Slots, you can get lucky just about anywhere.
Dearly beloved, we are gathered here today to... Has anyone seen the bride and groom?
Sorry, we're here. We were getting lucky in the limo and we lost track of time.
No, Lucky Land Casino, with cash prizes that add up quicker than a guest registry.
In that case, I pronounce you lucky.
Play for free at LuckyLandSlots.com. Daily bonuses are waiting. No purchase necessary. Void where prohibited by law. 18+. Terms and conditions apply. See website for details.
Hey all, welcome back to the Real Life Pharmacology Podcast. I am your host, Eric Christensen, and I thank you so much for listening. Hope you enjoy the episode today, but first I want to remind you, at reallifepharmacology.com, we've got a 31-page PDF for the top 200 drugs. Definitely go check that out. All you need to provide is an email. We'll send it to you. Also get you updates when we've got new episodes and new content available as well. So again, reallifepharmacology.com. If you want to track me down, comments, questions, send a message to me at mededucation101@gmail.com. Otherwise, you can connect with me on LinkedIn as well. Eric Christensen, PharmD, BCPS, BCGP. All right, so let's get into the medication of the day today, and that is fluconazole. Brand name of this medication is Diflucan, and this is well known to be an antifungal medication. Also, sometimes you'll hear it called an azole antifungal agent. And this medication inhibits the action of linosterol 14-alpha demethylase. And basically what that does is it helps produce ergosterol. Now, ergosterol is necessary for fungal cell membrane formation. So basically, by using fluconazole, we're blocking the production of necessary components to basically build the cell membrane. Now, what type of infections can fluconazole be used for? Candidiasis, so that's things like thrush, as well as vaginal candidiasis, cryptococcus. Off-label uses, you might see blastomycosis, tinea infections. So basically, there's a lot of different fungal infections that fluconazole can be used for. Adverse effect profile, I would say in my experience, I've seen the medication in general be pretty well tolerated as far as kind of mild to moderate dose-limiting adverse effects, GI upset, maybe some dizziness, maybe a little bit of a headache has been reported in the literature. But again, not incredibly common adverse effects there that patients are going to encounter. Other potential more serious, but obviously less common or rare adverse effects, you will definitely hear of hepatic injury or liver injury reported in the literature. Again, probably not very common in patients with candidiasis, and maybe they're getting a one-time dose, for example. But as a patient is maybe on this medication longer, taking it more often, higher doses, then we might be a little bit higher risk for liver injury there. In addition, think about other medications the patient may be on, or other comorbidities that may put them at greater risk for liver injury. That might be a situation where we're a little bit more cautious, or maybe watching it a little bit more closely. Another thing to think about, diflucan or fluconazole has been associated with QTc prolongation. So in patients that are on higher doses, maybe longer periods of time, we've got other risk factors such as electrolyte abnormalities or other medications, which I'll talk a little bit about in the drug interaction section. Those are patients that might be at a little bit higher risk for QTc prolongation. Monitoring parameters, LFTs are probably the most common monitoring parameter you'll want to track. particularly if patients are on this medication for a significant period of time, or they may be at risk for hepatic injury. Those are two situations where we'll probably be a little bit closer, a little bit more closely monitoring LFTs there. And then, of course, if you do have concerns with QTC prolongation or something like that, you might want to check electrolytes and potentially an EKG as well. Kinetic things that are important. I think from a kinetics standpoint, absorption of the drug is important because you'll often see patients potentially with more moderate to severe infections. If they're hospitalized, you'll see IV fluconazole used. And it's important to note that the bioavailability of oral fluconazole is very good. So typically we can just do a 1-to-1 conversion there. So if they were taking 200 milligrams a day of IV fluconazole, we can usually transition them to 200 milligrams per day by oral agent if we're able to convert them and maybe they're heading home or being discharged, but we still want to continue giving them the antifungal medication for a period of time still. It is primarily excreted in the urine as unchanged drug. I think it's approximately 80%. So I think that's important to note. But notoriously, fluconazole is associated with the CYP enzyme system. And it's not because the drug is broken down by the CYP enzyme system. It's because it causes tons of drug interactions and alters the function of the CYP enzyme system. So I'm going to spend a good chunk of time here after the break talking about drug interactions. If you're in the market for pharmacist board certification study material, such as NAPLEX, BCPS, ambulatory care, medication therapy management, or geriatrics, definitely go check out meded101.com/store. We've got a growing list of resources. We've produced test prep content for several years now, and I think we do a good job of preparing candidates for answering questions and trying to pass their board exam. In addition, if you're a nurse, physician, nurse practitioner, med student, definitely go check out meded101.com/store. We've got a growing list of books and resources that can really help you understand medication management and really give you a sense of some real-world situations and scenarios that you're going to have to deal with or you do deal with on a regular basis. So again, all those resources, including an opportunity at a free Audible book if you've never had one before, you can find at meded101.com/store. All right, so let's spend some time on drug interactions. First, if you have a medication, if you have a patient that you're going to start on fluconazole, I would strongly encourage you to look up the potential for drug interactions. There are a ton of different effects. So first off, CYP2C19. So fluconazole strongly inhibits the action of CYP2C19. Probably the most notorious drug interaction with CYP2C19 is clopidogrel. Clopidogrel is a prodrug that's activated by CYP2C19. So with fluconazole's action, we could potentially reduce the effectiveness of clopidogrel. Definitely an important interaction to think about. Other potential impacts through CYP2C19, xylostazole, not used terribly often, but concentrations could rise. Phenytoin is another example, and I've actually laid out a case study in one of my books. Honestly, I can't recall if it was The Thrill of the Case or Pharmacotherapy, but phenytoin concentrations can rise on account of fluconazole interaction. So I remember this case situation. A patient was started on fluconazole for 14 days. I believe it was for a Candida infection. And what ended up happening was patient presented with ataxia, dizziness, falls, sedation, confusion, and symptoms of phenytoin toxicity. And so that drug interaction, adding fluconazole on top of phenytoin, increased the concentrations enough to put the patient in the hospital due to phenytoin toxicity. So can't stress that enough to recall drug interactions and paying attention, particularly when you use a drug like fluconazole. So in addition to 2C19 interactions, we've also got CYP2C9 interactions. Okay, so the most classic example here is warfarin. So it is the primary pathway that the strongest enantiomer of warfarin is broken down by. And with that, you can have significant increases in INR when fluconazole is added to warfarin. In addition to CYP2C9 action, we can also have CYP3A4 inhibitory interactions. So apixaban, aripiprazole, some of the statins like simvastatin and atorvastatin, colchicine, migraine medications, fentanyl, these are all examples of medications that are broken down by CYP3A4. And when fluconazole inhibits the action of CYP3A4, this can lead to higher concentrations of some of those drugs I have listed. So keeping an eye out for adverse effects from those medications whose concentrations are increased is going to be a way you're going to monitor for these drug interactions. But again, this is why if we've got other alternatives, we try to avoid fluconazole if we can there. In addition, I wanted to mention QTC prolongation more specifically. So thinking about some of those agents, antipsychotics, methadone, quinolone antibiotics, and especially a drug like amiodarone, because that interaction with amiodarone is twofold, where there's potential for QTC prolongation in general between fluconazole and amiodarone, so kind of that additive effects. But fluconazole can also inhibit CYP3A4, which breaks down amiodarone. So it can increase the concentrations of amiodarone in addition to the additive QTC prolongation effect. So again, tons of potential drug interactions with fluconazole, and you need to look these things up. You need to pay attention. You need to educate patients, and we need to hopefully identify an alternative to fluconazole if we can, particularly in our polypharmacy geriatric patient population. All right, so that's going to wrap up the podcast for today. If you enjoyed the show, leave us a rating, review on iTunes or wherever you're listening. Greatly appreciative to all of you who have done that already. Go subscribe, reallifepharmacology.com. Get your free 31-page PDF, great little study guide if you're taking board exams or pharmacology exams, just to brush up and make sure you remember some of the most important clinical pearls and clinically relevant pearls for your exam there, or if you just want a little refresher, or if it's been a while for you. So go find that resource at reallifepharmacology.com. If you want to connect with me, comments, questions, medaeducation101@gmail.com, or track me down on LinkedIn, Eric Christensen, PharmD, BCPS, BCGP. I think that's going to wrap it up for today. Thank you so much for listening. Take care, and I hope you have a great rest of your day.
Okay, round two. Name something that's not boring.
A laundry? Ooh, a book club. Computer solitaire, huh?
Ah, sorry, we were looking for Chumba Casino. That's right, ChumbaCasino.com has over 100 casino-style games. Join today and play for free for your chance to redeem some serious prizes. ChumbaCasino.com. No purchase necessary. Void where prohibited by law. 18+ terms and conditions apply. See website for details.